Hello, I'm Eric Holdeman, and this is Disaster Zone, a show about emergencies and disasters that can happen anywhere and at any time. And today we're talking with Honora Lane, Interim Executive Director for the Northwest Healthcare Response Network. And that's kind of a mouthful there.
Just call us the network.
Yeah. Well, I think it's good to have the Healthcare Response Network in there because really I think this is pretty unique. King County had some real leadership on this for a number of years, and it's now changing. And that. So how about, can you provide some background on the Healthcare Response Network?
Sure.
And how what it was initially and then how it's changing today?
Sure. Well, the Northwest Healthcare Response Network is now a nonprofit charity here in Washington State that really coordinates emergency preparedness activities with healthcare organizations and our community partners serving the Puget Sound area. We started, as you said, our history based in King County Public Health Seattle, King County, really as a healthcare coalition that was brought together to bring healthcare organizations and community partners together around emergency preparedness initiatives. Since 2005, that program has been going on, and similar efforts were going on in Pierce County. And in 2012, we decided to align our efforts, and then in order for us to expand our work and look to the future of the work that we wanted to do, we launched as a nonprofit this January, and that's where we are today.
Okay, and what drove the nonprofit status? Is that, I know there's been, if you will, a ton of money, federal money that was provided for a broad swath of emergency management, health, fire, police, and that's went from about $3.2 billion nationally to $1.2 billion, so it's significantly decreased. And one of the things I've been talking about is how do we sustain all these good things now that federal funding is going away? Is this?
Well, I think what you're describing has exactly been the case for us. We certainly have seen an infusion of money over the years to public health and healthcare preparedness. But like a lot of those federal grants, the dollars have been reduced. In fact, just in this upcoming fiscal year, almost a 40% cut in funding for the healthcare preparedness work in Washington State.
And that was from last year.
That was from
and there's a cut before that also.
Correct.
Right,
Every year we've seen the dollars go down. Yeah. But it was really work that we've been doing since 2005, building relationships, building capability and capacity in our community. And it was really a recognition from our public health partners and importantly our healthcare partners that said this is important work we want to sustain in our community.
Okay.
But given the changing federal funding environment, we need to think about different ways to do this. And the interest in transitioning to a nonprofit really came from our interest in finding a more sustainable business model that would allow us to continue to do the good work, but also think about various ways of funding the work and resourcing in the midst of declining federal dollars.
Okay. And I've been very interested in regional, I think I'd say disasters don't recognize the artificial boundaries we have. Diseases certainly don't
Correct.
recognize a city, county, state boundary, international boundary. We're seeing diseases travel across the world pretty quickly these days because of the international travel side of it. So, but it's not easy. I tell folks that I had hair before I started trying to do regional types of things. So, what was the biggest challenge in merging Pierce and King County? Because a lot of times, you're trying to do the same thing, but it's hard to merge those efforts together. So,
it's true. I think the interest in alignment came in part because of the way the medical market is evolving and the fact that a lot of the medical systems we need to work with serve across counties and don't really recognize those geographic borders that we think about in emergency management. The merger of the two coalitions has been beneficial for those organizations and it has allowed us to really streamline and standardize some of our work. But it certainly did come with some challenges, and really that's about understanding what the local communities do, how they do things differently, how the healthcare organizations we work with kind of interact with the community partners, and trying to find commonalities that we can leverage and build upon for us to best serve those healthcare organizations and those community partners. By and large, I'd say it's been a very successful transition that we're really proud of, but it really is a good reminder in emergency preparedness. all things are local, and we really have to understand what that local environment is and how we can identify the issues that are going to impact us most at the regional level, and think about how we can creatively problem solve, working together and coordinating at a regional level across jurisdictional boundaries.
Okay. And how's this effort, and people, it's whether you're comparing sports teams or wherever, we're always trying to compare and gauge where we are versus others. Nationally, is this way ahead of the curve? Is this what other regions are doing? Just where would you put the healthcare response network here that we have in comparison to other metro areas across the nation?
I think from a healthcare coalition standpoint, ours, I'm proud to say, is a very robust coalition and really leading the nation in the model that we've created, in the scope of work that we do, and in the scope of the organizations we work with. We have two large metropolitan counties that we serve primarily, although our reach in terms of the impact of our work serves much more broadly in Washington State and in the Northwest. I would say the coordination across counties is not unique for all healthcare there's a lot of coalitions around the country that have to do more regional coordination. I think the way in which we're going about it, the complexity of the issues we need to deal with, is somewhat unique to the Puget Sound area, and we have to think creatively about how to tackle those issues.
Okay. So, we come up with a list of questions. Here's a question that wasn't on the list that you made me think about. I tell folks when we say region, you have to define, well, what do you mean by regions? And if you talk to federal agencies, they think in multi-states.
Sure.
So, why not Kitsap County? Why not Snohomish County? Why not, I don't know, even Yakima County? I mean, how did it become defined as King and Pierce?
So Washington State is divided into 9 homeland security and public health regions.
Okay.
And the foundation for the healthcare coalition work and the public health and healthcare preparedness work was aligned with those regions. King County was its own region.
Region 6.
Region 6, and Pierce County was also its own region, Region 5.
Okay.
The interest in aligning was really in order to better serve the partners that we work with, and to better reflect the community needs that we see in a disaster.
Makes sense.
Yeah.
So, what types of organizations are involved with the network, and how's the membership work?
Sure. Well, our primary members are healthcare organizations. I'm really proud to say that as we transitioned to the nonprofit and really sought more membership in the organization, all the leading healthcare organizations here in the Puget Sound area, and many of whom serve throughout Washington State, stepped up and said they wanted to become members and make financial contributions. So we work with those healthcare organizations and all healthcare organizations.
Are those, I always think of hospitals, but there must be something beyond hospitals.
Sure, yeah, and it's one of the really defining characteristics of our coalition is how broad our reach is within healthcare. The major hospital systems, which also provide other services, not just hospital services, are members of our organization. Large clinic systems are members of our organization.
Okay.
Large kidney center, the Northwest Kidney Center, Puget Sound Blood Center, Sound Mental Health. It's really representative of a diversity of organizations that serve in the community, and our job is to work with them and to serve them.
Okay.
We work with all types of healthcare organizations, and membership is open to all types of healthcare organizations and organizations that support them. Our work is only successful if we have good partnerships with all of the organizations healthcare depends on: emergency management, EMS, law enforcement, all of those partners, public health especially, all of those are partners we work with at our table. And as we evolve, we're looking forward to bringing in more business partners and more private sector partners to really think strategically with us.
Okay.
And plan innovatively.
And, you have different size organizations there, I'm sure. So is there a monthly due, an annual contribution? Are there dues? I mean, how does that work as far as truly funding?
Sure. So in the transition to the nonprofit, we did create a membership model that is a dues-based model. It's based on an annual contribution to the organization. And that model is one that will kind of continue to evolve and grow as the organization grows. We also want to depend not only on those dues, but also look at other community contributions, whether it's corporate foundation grants or other sorts of philanthropy or individual giving to support just like supporting any other nonprofit charity in the area. We want partners of all kinds to help contribute to our work.
Right. And so, again, I've learned a lot being in emergency management around healthcare.
Sure.
Folks, there's pre-hospital, which is the fire departments, ambulance services. Is that part of this also, or where's that, it's in that continuum of care, where's the response network?
So we certainly work with all of those partners, and we have, in fact, TriMed was one of our founding members. When we transitioned, we have EMS at the table in all of our planning, all of our meetings, and we certainly support and coordinate with them on all of the work that we do. There's a number of other organizations that we partner with, but we certainly consider the pre-hospital community to be part of who we serve.
Okay. And then, what motivates folks organizations to want to join this? Because it was a government type service, and now it's this, are you a 501c3?
We are a 501c3.
Okay.
Yeah.
Maybe we should say how to contribute, I guess. Folks at home, you too can donate. But what's motivating them to join and pay an annual due? What are they getting out of it?
I think ultimately they see the value in the work that we do in support of their ultimate mission, which is to continue to provide patient care in a disaster. All of us in healthcare and those that support healthcare have the shared interest of making sure healthcare can keep its doors open, that they stay operational, and most importantly, that they save lives and serve patients and the surrounding community. So it's an important mission. We all believe in our efforts to be resilient in a disaster, to recover from a disaster. And I think that draws them, recognizing this is something we all have to do together. But I also believe they see value in the way that we do our work, the programs that we offer, the services we provide their organizations, and the true quality in the work that we deliver. I believe strongly that we really are a national standard in the quality of the work that we do.
Okay.
And I think they recognize that.
That's great. So, it's not just you. You're the acting executive director.
Sure.
How many staff are there, or positions are there, and what types of positions are there within the organization?
Sure. Right now we have about 10 staff. It'll be growing as we are growing as an organization. I expect the staff will grow. We have planners, so folks with healthcare emergency management experience that help do planning. Some of these folks have clinical expertise as well, which is incredibly valuable. We have a position that is focused on training and exercises. We have administrative support. We also, in partnership with the Washington State Department of Health, co-manage and lead the state's healthcare incident management system, WATRAC, which is a web-based system we use to coordinate across healthcare organizations day to day, as well as in an emergency.
All right. And we just had a workshop regionally here. It's a supply chain workshop, and one of your staff attended that. And I'm terrible with names.
Corey Fairbanks.
Who moved here from Arizona.
Correct.
I remember that, had been a medic and
Yes.
and so it's kind of the example of healthcare gets into a lot of things. Healthcare has a supply chain.
Absolutely.
Yeah.
I think it's one of the most important issues, and why we're so glad to collaborate with the work that you and partners have done is really the supply chain resiliency is going to be critical to healthcare's success and in a disaster, and their ability to continue to provide patient care and serve the community. So we want to be on top of those issues, just like any other industry, and thinking about what issues we need to consider, what solutions we can come up with to try to mitigate impacts in a disaster.
Okay. Well, we're already about halfway through, so don't go anywhere.
Okay.
And the same applies to you folks at home. Don't go anywhere. When we come back, we're going to be talking more about the Northwest Healthcare Response Network, I want to say. Is that right?
Yes.
Yes. And learning more about the nonprofit status and how this functions not only before the disaster, but during larger scale emergencies and disasters. I don't think you'll want to miss that, but come back after watching this message.
In the event of a catastrophe, you need to know what to do to make it through. By preparing now, you and your family will have a better chance of surviving when a catastrophe happens. Here are 3 tips to get you started. Have an emergency plan with meeting places and an out-of-area contact. Prepare a supply kit for your family and pets that includes what you need to survive for 7 to 10 days. And be prepared to help each other. Start now and take the first step to protect the ones you love. For more information, visit makeitthrough.org or find us on Facebook.
Hi, I'm Eric Holdeman. If you're just joining us, coming back from our break, today we're talking with Honora Lean, who's the Acting Executive Director for the Northwest Healthcare Response Network. And we'll just go right back into the questions we
Sounds
have
good.
been talking about. Honora, before we get more to the disaster side of things, because I think it's fairly unusual to see a nonprofit actually working on that side. But you switch to a nonprofit status. What's the biggest challenge you're facing with that?
I think the biggest transition or challenge for us is really just transitioning the business, really thinking ahead about how we grow the business, how we really create a sustainable financial model that's going to allow us to be successful for years to come. As we spoke about earlier, in particular, as the federal dollars are declining, the challenge for us is really to look innovatively and think outside the box about how we continue to resource this work.
Okay. And let's talk about that emergency side of things. A lot of nonprofits are involved beforehand on preparedness types of things, doing very good work in that. But when an event happens, they aren't necessarily integral, right in there in the mix of things. So how does this public-private partnership work when there's an emergency?
Sure. So we have an important role that's defined for us in response, and that is really to serve as the Healthcare Emergency Coordination Center. So we're really the first go-to for healthcare to coordinate situational awareness, so information sharing, what is going on within healthcare, but also we're conduits to make sure they have information about what's going on. We help support resource management for healthcare. We facilitate mutual aid and resource sharing across the healthcare system. And then we're really a conduit and connection to make sure that information about the healthcare system and impacts and resource needs is communicated up through the health departments in the communities we work in. They have the lead for health and medical response, so we provide information to them. And then through those organizations, we also liaison with the emergency operations centers.
Okay, and then one of the big challenges is we have multiple counties. Certainly Pierce and King are involved with this. And there's a number of cities within each, in particular in King County, that have their own emergency operations centers. So how do you staff those things? I think you said you have about 10 people, right?
10 people.
And they can't be everywhere at once, and you have to have some center yourself. So how do you staff the liaison function?
So right now we have a core of our staff that will operate out of our office, and then we'll either have liaisons from the health departments come to us, or we'll send liaisons to the health departments. And we really rely on the health departments to be conduits for us in the EOCs if we can't send a representative ourselves. But as we grow as an organization, and now that we have an expanded role, one of the things we'll be working on is training volunteers, whether they're volunteers from the healthcare community or other volunteers, to train as liaisons that can help us sustain our operations within the organization, but also serve as liaisons in the health departments or in the EOCs.
There's a medical reserve corps that's out there. Is that part of what you're doing, or is it just an element? Is that where some of your volunteers would come from?
It's work that we're going to be doing more of now that we've made the transition out of King County government, is to work with the medical reserve corps and look potentially at developing teams within the reserve corps, but also look at other options that we can utilize to manage volunteers that we might want to use.
Okay. And I'd say things are changing so rapidly, very rapidly, because of technology aspect. And one of those big changes is that I remember my mother had her gallbladder taken out in around 1965, and she was in the hospital a week, and I had mine taken out like 5 years ago, and I think I was in 2 days, if that. So people are being pushed out, probably pushed out is too strong, being sent home earlier because of the types of care, types of surgery. It's it's no longer as invasive as it used to be. Laparoscopically surgery, I guess. But how's that home medical care is a significant piece of this. There's dialysis centers, but there's people at home on dialysis that
Certainly
have the ability to do that, and other types of thing where people might have been institutionalized at one time. They're actually in the home. So in an emergency situation, I think that's very difficult now.
It's certainly a real challenge. One of the reasons we work with home health and home care providers is to create opportunity for them to work together and how they're going to work with their clients, and to help us think of strategies about how we can best support them. It's important for all of us to do education, for healthcare facilities, if you're discharging patients, to remind folks about the importance of thinking about what they'll do in a disaster. It certainly is a vulnerable population, and there are a number of folks who could be having just been discharged or who are receiving care in the home that we need to think about. It's part of why we've been so intentional about making sure we're working with all types of healthcare organizations that support healthcare delivery in a variety of different settings. It's not just the hospitals, it's really across the continuum of care.
Okay.
We want to make sure we're providing education, training, tools, and thinking about strategies about how best to support those individuals too.
Okay. And another aspect of our society today, we have the boomer generation I'm part of here, and I seem to be getting older day by day. And
No.
so, and heavier. And so, the growth in assisted living and nursing homes and that, it's big and getting bigger. Do you have any part of that aspect in the Healthcare Response Network?
We do. We work very much with nursing homes, assisted living. There are over 1,700 long-term care facilities here in the King and Pierce County area. It's a lot of work to try to reach out to those organizations. I'm proud to say we have a very impressive long-term care evacuation plan and mutual aid plan that we've worked for years on. We need to continuously do education on that, training, and continue to reach out to new partners as that market evolves. We want to make sure we're able to reach out, learn about, and work with all of the organizations.
Yeah.
It's part of the importance for us in making sure we sort of build a solid financial base, is that we have a lot of partners to work with. As I said, it's 10 staff right now. We're growing, but that's a lot of healthcare organizations to connect to, and so the importance for us is making sure we're solid financially and that we're building a strong enough organization that we can really work with all the healthcare providers in the community that we need to reach.
Okay. And for folks at home, one of the things I'd say is, we talked about knowing the status of your emergency plans at schools and stuff like that, but the other piece is mom, dad, grandma, grandpa, whatever, could be in some type of institutional setting, and it's good to ask them what their plans are there. Do they have emergency power capability? Because we went through a winter storm in 2006,
Sure.
and there was actually evacuation of at least one, maybe a couple homes, and that was a really big deal because people were getting cold and they didn't have power, they didn't have heat.
That's right.
And distributing just those few, if you will, patients around is a big challenge.
It is a big challenge, and I appreciate that you are raising the issue. I think it really is so important for family members to think about if their loved one is in a facility or is being cared for by the medical system. On one hand, I'm proud to say that our healthcare community is really invested in preparedness. They're leaders in the area, and all of their organizations are doing work. But as a family member, you should be thinking about this. You should be asking questions. I think one of the most important things a family member could do is just remember, when you think about having your alternate contacts for an emergency or your out-of-state contacts, make sure that if you have a loved one in a healthcare facility, that facility knows what some of your alternate contact methods are in case they need to reach you in an emergency. We all know the communication lines may go down, so you want to make sure those people that you have responsibility for, care about, that their providers know how to reach you too.
Okay, great points. So we're not at the end here yet, but we're kind of coming down the tail side. So what innovations do you expect to come from establishing the network as a nonprofit versus being a government service?
I think first and foremost, the opportunity we have to really think creatively about how we fund ourselves, to look at a diversity of funding streams. I think it really allows us to have more opportunity to engage with different partners in the private sector. I love that we're housed here in a community that's really known for innovation in all sorts of industries. And my hope is that in the transition to the nonprofit, and as we grow as an organization, we're really able to partner more with the private sector and think about different innovations that they're working on and how we can apply them to this work. I think the nonprofit structure allows us to do that more easily than we might embedded in government.
Okay. And earlier in the show, I asked about how we kind of compare, to other healthcare networks, and you talked about how, hey, we're really kind of ahead of the curve of PAC, or so. But what are some of the things that are different? What sets us apart?
By and large, I think it's the size and the scope of the organizations that we work with. Certainly, the transition to a nonprofit is relatively unique in the country. The U.S. Department of Health and Human Services will tell you there might be anywhere 400 healthcare coalitions in the country. We're one of just a handful that are organized as a nonprofit and that really have the contribution and support of healthcare in helping us to achieve our mission. And that is not only in their time and their coming to meetings and being participants, but also financial contributions from healthcare. We're really leaders in that area. I'm proud to work with two other healthcare coalitions, the MESH Coalition in Indianapolis and the Northern Virginia Hospital Alliance in Northern Virginia, who themselves were really leaders in creating differently structured but similar nonprofits to really sustain their healthcare organizations and create opportunity for healthcare to support that work. And we work closely together. We share a lot. We try to help other coalitions.
Okay.
Do work through our National Healthcare Coalition Resource Center. But I think the real innovative model for us is how much reach we have into the healthcare community, the quality of the work that we do, and the fact that we've really been ahead of the curve in thinking about how to create a sustainable model for our work.
All right. Well, we got 2 minutes left. Just any last thoughts before we close the program?
I think this is, it's easy to take for granted the sort of safety of our community, and it's easy to think that healthcare will just be there whenever we need it. On one hand, our healthcare community is doing tremendous work to be prepared for a disaster, but I think it really is important for us all to recognize how important it is for us to make sure that we have a healthcare community that can continue to serve in a disaster, can keep its doors open, that will be resilient. It's important in terms of life safety. It's important in terms of our regional economy. And I'm just always proud to go out and speak about the work we do, because I think more people should know how important this is to their organizations or to their families.
And if people want more information, what's the website that they can go to?
www.nwhrn.org.
Okay, and that's on the screen.
Thank you very much.
And so for more people, they can go get that. Thank you so much, Honora, for being on the program.
Thank you, Eric. I appreciate the opportunity.
And as a special treat, you get that Disaster Zone coffee mug. May your desk not be a disaster zone itself, but thank you for being on the program.
I appreciate it. Thank you so much for the opportunity.
Yes. And for you people at home, this brings us to the close of our show today, but I'd like to point out, we talked about having less government and more community participation. Here, the Northwest Healthcare Response Network is a nonprofit. Actually, if you're an organization, healthcare, or just a private individual and want to make a donation, you can go to their website. They take credit cards. It's a 501c3. It's tax deductible. And if that's something that you're interested in and want to do that, I encourage you to make a contribution. So thanks for tuning in and learning more about what you and others can do to become better prepared for disasters. And remember, if you're going to get prepared, today is a good day to start. Thanks, and tune in again soon. Bye-bye.